And now we're joined by Mark Stevens, the MCH Graduate Scholarship winner. Mark, welcome.
Thank you.
All right, so tell me a little bit about this scholarship and how it all came about for you.
That's an excellent question. I'm actually very honored to be a recipient of the Go Beyond MCH Graduate Student Scholarship. And this scholarship offers opportunities for education development, leadership development, networking, and it provides an opportunity for a person like myself to come to a forum to learn about emerging and national MCH issues. And the scholarship itself, for me, was the opportunity to come to this conference and to network with MCH public health professionals from across the country and just to continue to learn about MCH, a field that I love and passionate about.
Tell me a little bit about who you are. What are you studying? What do you hope to do with it?
I'm currently a doctoral student at East Tennessee State University, and I'll be graduating in May, which I'm very excited about. And I'm passionate about MCH. I'm passionate about infant mortality rates and why they're so high and how can we lower them. I'm passionate about improving paternal involvement in pregnancy outcomes and how we can get fathers more interested in seeing their children grow and be happy and healthy. Because I think that's also important. Sometimes in maternal and child health, we talk about the mother and the child, but we leave out the important factor, which is the father, who's an important unit of the family as a whole.
You are so right. It's very interesting because I've never actually heard somebody say it like that, but that sounds more like a sociology situation instead of an epidemiology world, which is what you're in. How do you bring the two together? That's
a good question, and that's kind of what I think that's what my niche is. I think that's why I'm important to the field. Moving from being as a student to a public health professional and showing that it's not just psychology or sociology, but it's actual science and evidence based that a father has a very important impact in a family structure, in raising their children. And so if we can merge that into our research, merge that into our public health programs, then maybe we can see changes in some of the health outcomes that affect women and children.
We said we were going to talk about challenges that we face down the road. Do you think that's the biggest one, or are there others that needs to be wrapped into this envelope too?
Well, there are others as well, but I think that there have been a lot of innovations in MCH. And some of those have been looking at men's health as it applies to the life course model. And so looking at men's reproductive health, preconception health, and the role of expectant fathers in pregnancy outcomes. And so there are excellent organizations who are doing a lot of this work currently, such as Commission on Paternal Involvement in Pregnancy Outcomes, who in 2010 outlined 40 practice, policy, recommendations to bring awareness about the role of expectant fathers on pregnancy outcomes. There are also organizations such as the American Public Health Association, Maternal and Child Health, Paternal Involvement in Pregnancy Outcomes Committee, whose goal is to provide MCH communities with effective strategies on how to improve paternal involvement in pregnancy outcomes, particularly in communities where paternal involvement has been low and pregnancy outcomes have been poor.
Okay, so what do you hope to get from being here? What are you going to be able to take home with you and put into practice in your work?
That's a great question. Coming to this conference offers a great opportunity to network with MCH professionals from all over the country. And so being here and being around them, I get to learn about the work that they're doing, about the programs that they're implementing, about the data analysis that they're doing. And that's my main focus as an epidemiologist. And I can incorporate a lot of new ideas into my own work. It also offers opportunities for training, such as I had a chance to attend the mortality review data systems training yesterday, and I learned a lot about EpiInfo. And this is a great tool that I can use in survey development. It's also a great tool that I can use for doing a lot of data analysis as well. So I definitely start to incorporate more EpiInfo application into my own work.
Well, congratulations on the scholarship. It sounds like you're putting it just to wonderful use, and I'm sure we'll see great things from you in the coming years.
Yes, ma'am. I certainly hope so.
All right, Mark, thank you so
much.
It was a pleasure meeting you.